As a pandemic sweeps the globe, countless individuals are being affected. Companies across the U.S. are requiring their employees to work from home as a response to the novel COVID-19 virus. But our nation's truckers will continue to work day in and day out to bring us the supplies, medications, and food we need to live. Dr. Dixon talks about how drivers can be better prepared to take on the road in these desperate times.
What I'm recommending my drivers do is obviously the same thing everybody else is doing as far as the hand washing and the sanitizing, but I'm going to take it a step further. Start with cleaning out your truck, okay? Get rid of all of the stuff that doesn't have to be in there. Sanitize the inside of your truck and keep hand sanitizer next to the door. So you need to prepare to make sure that your area, your world is not contaminated, right? So it's free of contaminants. So you want to make sure that once you leave the truck, whatever happens out there, but that you can grab the hand wipes and the sanitizer before you get back in the truck, clean yourself off so that your world stays clean.
But one of America's largest and most vulnerable groups of workers, truck drivers, don't have that ability. The job requires drivers to travel nationwide and come into contact with goods shipped from overseas, which could affect not only them, but those they come into contact with.
What exactly are you encountering? Are you having any patients come in that are maybe have some of the symptoms, or what have you personally been dealing with there at Driver's Health Clinic?
I have not seen one. Mm-hmm. So my drivers come to me for the DOT physicals, the drug and alcohol testing, the wellness care, the chiropractic. I haven't seen one come in actually sick at all. So I'm incredibly lucky. But no, so far we're all up and kicking. As far as that goes, I do actually, see regular non-drivers as well. And really in the truck stop itself, I haven't seen much of it at all.
A Business Insider analysis found that service workers and those in jobs that lack flexibility are among those with the greatest risk of coronavirus exposure.
So what are you recommending if they are experiencing some symptoms?
Do not go to a clinic in a truck stop. Okay. I've heard there's a few that are starting testing, but then you're around a bunch of people and you don't want to do that. So you do not want to contaminate anybody else. Okay. So if you are feeling the symptoms, as far as you have a fever, if you have that shortness of breath.
Since COVID-19 is a respiratory disease and often causes pneumonia, having a history of smoking could increase the risk of more severe respiratory distress or pneumonia, stated the CDC.
All of those respiratory symptoms. If you feel like you need to be tested, call your doctor and your doctor will tell you where to go. And I can't tell you where to go because it's changing every day. So they're doing a lot of these drive-through testing, which is perfect, right? You can go through, they can test you. Hopefully they have availability for the truck. I haven't really looked into that, but hopefully they will, but that's perfect for you, right? You don't have to get out of the truck. You don't have to contaminate anybody else, but you also aren't taking the risk of getting contaminated from somebody else. So it goes both ways. That goes the same with, taking your loads in, right? I've heard drivers say, well, I can't get out of my truck now. I'm like, you don't want to get out of your truck. Mm-hmm. You want to stay in that world, right? So you want to stay in that world where it's clean, and you want to stay in that world where you're not, having hand-to-hand, communication. So the less paper that you're passing through and the less actual time that you have with anybody else, the safer you are. So you guys are actually in a perfect world, so to say, where, you have nothing but your truck. So if you can keep yourself safe and keep your communication with others, your limit the actual time with anybody else, you are more likely to stay safe.
Mm-hmm. So what do you recommend if they're going to stop and get food or go to the restroom or anything like that? What other precautions are you recommending for them to do then?
Make it brief. So I know the TA Petros today, about an hour ago, said that all drivers' lounges and gyms are closed. As much as that stinks for the drivers, it is what it is. But again, you want to decrease that time around other people. The restaurants are still open. At least ours is today in the restaurant downstairs. So, but they're making everything 6 feet apart. You want to keep your groups less than 10 so that you're not contaminating one another. You have to stop, obviously, right? You have to use the facilities. Go in and get back out. And that's why you want to go back out to your safe place. And that safe place should be nice and clean. So start with making sure that the areas around you are clean. Gut care is number one on keeping your immune system strength up, I am doing a lot of kombucha, probiotics, those things to keep your gut in check just for overall good immune health. Okay. I also am drinking these, vitamin C packs and multivitamins. Make sure this time is not the time to get weak on that. I walked into Publix last night and I saw that all of the produce was full, but everything else was empty. And it kind of broke my heart because all of those fruits and vegetables that are full of vitamin C and full of the things that keep us healthy, if the virus does come into you, are you actually going to take it or are you going to fight it off? So you need to keep your immune system up and high. So go ahead and do all of those little things that would prevent you from catching any cold, flu, or virus. Make your body the strongest that it can be so that you do fight off anything if you happen to come in contact with it.